We do want to thank the Associated Medical Schools of New York for putting us in touch with Dr. Hernandez, and we're now happy to welcome Dr. Rafael Hernandez back to WBAI. Thank you for joining us.
Hey, Jeff, how are you? Thank you for having me.
So, how have you been since Celeste and you last spoke for the original Coronavirus Diary segment? What has it been like having this kind of introduction to working as a doctor?
Yeah, well, it's been interesting. So since then, I've actually moved to Miami, Florida, and I've started my residency. I'm almost done with my first year of residency. It's been an experience. It's been a lot of ups and downs. I have worked with COVID patients down here, with very critical patients who have recovered and others who have not. I've dealt with. I've also sort of handled and dealt with family members who unfortunately have suffered losses due to COVID, pneumonia, and it keeps going. So I think it's a learning experience, and that's about it. Unfortunately, it's not so much I can say, but I think we're getting a little bit better, and things are hopefully looking up now.
Well, Dr. Hernandez, I'm really glad to have a chance to talk to you again. And that's very interesting. So now you've had experience treating COVID patients in two different communities, two different states, or two different cities. What is the difference, do you notice, between how things are going in New York and how things are going in Miami, or how the healthcare systems are working? Is there a big difference, or really not too much difference?
Yeah, so I think, hey, Celeste, I hope you're doing well. It's good to be back.
Thank you. So in terms of the healthcare system, I don't think there's much of a difference, or in terms of like the treatment that we're giving patients. It's very, very similar. It's evolved since we've learned a lot more about COVID now compared to almost a year ago. So, but otherwise it's been pretty much the same. I think that, I think that's the biggest thing, the timeline. Now things are a little bit more clear, and we treat patients with a little more certainty. So it was. I definitely remember during our last conversation, as you said in the interview, there were a lot of things at that time that we really did not know about, even how COVID-19 was transmitted and so on.
Right. Exactly. Yeah. I think now as a medical community, we're a lot more confident with treating our patients, being able to give them diagnosis, an idea of how things are going, what to expect. Even treating patients outside in the clinic, not just in the hospitals. And now we're giving the vaccine. So we're in a whole new phase. So I think it's been very helpful, very positive experience.
And Dr. Hernandez, I'm glad that you brought up the issue of the vaccine, because that is something I also wanted to ask you about. Obviously, something we were not nearly ready to discuss when we did our first interview. But
right.
we have been hearing from people, even on this program, on this station, and we've been seeing in the news. For example, I just read a piece that said about a third of members of the armed forces are declining to receive the vaccine. Some of them, they don't want it. They say that they would rather see how it affects other people before they take it. So I'm just wondering, what are your experiences with people who are hesitant about getting the vaccine, and especially in communities of color? And what do you tell people about the safety and the efficacy of the vaccine?
Right. So, I mean, so far things have been good with the vaccine. We've seen very little reactions. There's a lot of, unfortunately, that's just the world we live in. There's a lot of fear, uncertainty, a lot of misinformation. I encourage every patient to have the vaccine whenever possible. I myself had the vaccine. I had a positive experience with it. Very little side effects. So what I tell my patients, I tell them, first of all, I recommend that you have this vaccine. The side effects that have been recorded from patients who have had the vaccine during the trial and since the vaccines have been released have been very small and nothing compared to the possible side effects of having the actual disease. And, just go over the basic things. I tell them, have you ever had an allergic reaction or a severe allergic reaction to a previous vaccine that you've had in the past, such as the flu vaccine? And if it's no, the answer is no, then I tell them with full confidence I recommend that you take this vaccine.
And, I know our time with you is short. I'm thinking about, my recent visit to Elmhurst Hospital to help volunteer and just watching a lot of the attention that the essential workers were paying and the staff were paying to people who were coming in to get the vaccine at this time. This has been a very difficult period in our history. And I'm curious if you've had any positive moments, anyone you might have interacted with in a way that was just uplifting, that stand out in your first year in this profession.
You mean in terms of patients and families?
Yeah, a patient interaction or just something you witnessed, something that made you feel confident that we're going to get through this, or just an interaction you had in this first year that really just stood out, made you say, I'm so glad I am working in this profession at this time.
I think that I can't think of any specific interaction with a patient or family. There have been so many, but one thing that I can tell you for sure is that, the willingness, and I've had pleasure working with amazing attendings where I was previously at NYU Winthrop and where I am now at Jackson Memorial Hospital, and sort of the willingness and to help and the willingness to not give up regardless of what's going on, and just the care that they demonstrate day in, day out, regardless of how many hours are put into a week caring for patients. That in itself gives me a lot of hope. And I think that's what will get us through this. And also, I think I have seen a lot of positive reactions from patients regarding the vaccine. In my outpatient clinic, I've actually had a lot of patients come out and tell me, in the past I haven't had any vaccines, but regarding the usual vaccines that we have that we've had for many years, but can I have the COVID vaccine? I want to get the COVID vaccine. I do think that patients are aware, they're listening, they're informing themselves, and they're reaching out to their doctors for more information and for help. So, and I think that's all pointing in a very good direction right now.
And just finally, Dr. Hernandez, how do you think the experience of this pandemic and how fast it's moved and, sort of the depths of it, now turning the corner, how everyone's dealt with this, how's that going to change the way you practice medicine going ahead, or either that, or how do you think the American healthcare system will be different, will work differently now that we have had to deal with this major crisis?
Well, that's a big question. For me, this was my first introduction into the healthcare system. So, in terms of practicing and being an intern, a new physician. So, I think for me, this is sort of set up the standard of what I expect things will be from now on. I think that things are, in terms of just overall the information that's out there about medicine, I think that there's been a lot of ways in which you can get medical information, and I think this whole pandemic has made people aware of the possibility that the information you're getting from a non-medical source or from not from your primary care doctor, your doctor, might not be correct. So I think a lot of people have become a lot self-aware about that and learn to check their sources and turn to the right people and the right sources for information, which is, I think, a very good thing.
Dr. Rafael Hernandez, I want to thank you so much for joining us here on WBAI and bringing us up to date on your career and your work in the medical profession. So thank you so much for joining us today.
Well, thank you for having me. I appreciate it.